Now that you know a little more about diabetes, we invite you to watch our Personal Stories chapter. Here you'll meet real patients and the doctors who are helping them live with and control diabetes every day.
Hey, Alphas, how you doing?
Hello, good, how are you?
Good. So, Michael, what's new?
Not so much.
So we're going to talk about your diabetes a little bit, huh? I first saw Michael in the beginning of this year, and Michael presented with classic symptoms of diabetes.
When he was first diagnosed, I took him to his pediatrician 2 or 3 times within 3 or 4 months because he had a cold, he was never getting rid of it, he just never felt good, and I didn't think the antibiotics were working. I took him to his pediatrician and they tested him for diabetes.
And then during that time they established there was sugar in the urine and then checked the blood sugar, and that blood sugar was over 200 milligrams per deciliter, and that determined that he had diabetes.
Well, I didn't really feel the symptoms, but when I knew I got it, I just pretty much got it.
And in this age group, it's highly likely to be type 1 diabetes. We've seen him several times in the office, adjusted insulin. They do some phone calls with us, and we make sure that we try to have his blood sugars as near normal as possible and still have him do the usual things that he does in school and play. You been feeling well?
Yep.
Good. School okay?
Yep.
Terrific.
Because I really don't want him to be extremely different. I don't want him to, in the beginning we started eating a lot of wheat bread, and that was very different because when he sat at lunch at school, everyone had white bread. His principal's actually diabetic.
Oh boy.
So
that helps, huh?
he constantly is asking his principal, what's your blood sugar?
And he's just like...
Yep. Well, what happens is, I think it's an adjustment for everybody. The principal has diabetes, so he really is tuned into what living the life of diabetes is. And that makes it more appropriate for the rest of the staff to be able to be taught. And what we teach them is to try to have Michael be a student first and then a diabetic second. So we have a program every year that we run here at Edward Hospital for school nurses. And if there isn't school nurses, we have administrators come to it. And what they do then is they learn more about diabetes.
The history in diabetes in our family is I've had it for 22 years, and now Mike has had it for a few months.
Well, his diabetes is more common because mom has diabetes, and that risk of that is increased probably because of a genetic factor. But he's done well. His mother understands what's going on with diabetes. She's done pretty well for as long as she's had diabetes. So how about an average blood sugar? Do you know what your average blood sugar has been running?
I would say in the 200.
Okay. So he's running a little higher than we'd like, and maybe we need to talk about some insulin doses. What are the doses we're using now? Well, you know, what we try to do in our plan there is blood glucose concentrations at 200 are still too high for him. We'd like his blood glucose concentrations to be down closer to 100. And so that means we have to change his insulin first of all, and then make sure he's sticking with a healthy meal plan and that his exercise is appropriate and that all fits into his healthy lifestyle.
I would say it could be difficult at times. You know, he wants the juice boxes, so we're trying to iron out the hard parts, but I think as long as we, again, understand each other, he understands I'm trying to help him, and I understand that he wants to be 8, we'll work it out.